Hello, my name is Christina Brouse, and I selected Japan for my project. Japan has the universal statutory health insurance system known as SHIS, and it includes universal coverage for everyone. The national government sets the SHIS fees and subsidies to local governments, which includes regulations for insurers and providers. SHIS is broken into 47 regions that implement their own healthcare delivery and budget. In 2014, 127 million people lived in Japan. 25% were older than 64, and 20% of adults were daily smokers. The prevalence rate for obesity was 4%. Additionally, in 2014, out-of-pocket costs were $126 per person, and there were 2.14 numbers of practicing physicians per 100,000 in population. The CHIS comprises more than 3,400 insurers. Citizens are mandated to enroll into CHIS based on age, employment status, and place of residence. Citizens over the age of 40 are automatically enrolled in long-term care insurance. In addition to universal coverage, Japanese citizens have the choice to buy additional private health insurance. This includes life insurance, additional income in case of sickness, and hospitalization for chronic disease or cancer. The initial guaranteed basic coverage includes covering hospital, primary, specialty, mental health care, prescription drugs, home care services, dental care, and hospice care. Additionally, preventative medicine is covered through, which includes screening, health education, and counseling. For costs, the system is covered through general tax revenue and insurance contributions. Taxes make up 42%, premiums make up an additional 42%, and user charges make up 13%. In 2014, Japan's gross domestic product was 9.5%, and the cost per person was $3,703. Enrollees pay 30% coinsurance for services received, but 75 years and older only pay 10%. There are no deductibles, and local governments typically cover children's copayment. If you have health expenditures or do have copayments, this is tax deductible. If a catastrophic injury occurs for low-income people, the max they will pay is $337 a month. There is also long-term out-of-pocket cost ceiling between $3,000 to $20,000 that can be reimbursed to people. Japan keeps costs down through price regulation that uses critical cost containment mechanism. The mechanism requires 3 levels of decision-making to rate prices for services. Additionally, controlling cost is promoted through healthy behavior, short hospital stays, and usage of pharmaceuticals. By law, healthcare delivery systems are required to include structural process outcome indicators for effective and high-quality delivery for cancer, stroke, diabetes, emergency, prenatal, and disaster medicine. The government offers financial incentive to providers to achieve this. Wait times, however, aren't monitored. There are also some drawbacks in measurement of quality. Hospital accreditation is voluntary, with only 25% in 2015. There is no disclosure of names if hospitals fail accreditations. Public reporting is not required. Physicians aren't required to reevaluate their license once passing the exam, and clinical audits are voluntary. However, they do have a support center to handle complaints and promote safety. Some concern for the future includes rising costs of structural problems in the health system, the rapidly aging population, use of high-cost technology, and lower birth rates. Additionally, the health system does not focus on quality or efficiency. Instead, they push for quantity. Future goals focus on restructuring plans to eliminate deficits and sustain the physical cost. In 2015, the Japanese government met with young experts to gain their insight on what the healthcare in Japan should look like by 2035. The recommendations included focusing on quality of care, professional self-regulation, and integrating medical and social service sectors.